Bismillahirrahmanirrahim. The title of our lecture is Autoimmune Hepatitis and Immune Deficiency. Autoimmune hepatitis is a chronic disease of unknown cause and long-lasting disease in which the body immune system attacks the normal component of the liver, which is the hepatocyte, and the immune serum markers are present. They include autoantibodies against liver specific and non-liver specific antigens and increase in the level of the serum IgG. It's often associated with autoimmune disease. And the proposed pathogenesis of this disease is a combination of genetic and environmental factor. As you know that the autoimmune disease is always of unknown etiology, and it's a combination of the genetic and environmental factor. And the environmental agents which is trigger the autoimmune disease lead to necrosis, inflammation, and fibrosis, and liver cirrhosis. And the genetic factor include the HLA haplotype B8, B14, BR3, BR4, BW3. And patients with autoimmune hepatitis have low levels of T lymphocyte that express the CD8 markers. It's also associated with complement C4 deficiency due to consumption by the antigen-antibody immune complex. And C4 has a well-known role in virus neutralization. Failure to eliminate viruses may lead to immune reaction against antigen on infected cells. This is the genetic factor. The another factor is the environmental factor, which is include infections with virus like rubella, Epstein-Barr virus, and hepatitis A, B, and C. Also, drugs contribute in the autoimmune hepatitis, which is as pathologic agents for this disease. The pathogenesis, the current evidence suggests that there is a liver injury, which is a result of the cell-mediated immune attack. And there is apparent display of the HLA class 2 on the surface of the hepatocytes that express the self-antigen to the antigen-presenting cell. And this antigen-presenting cells present the hepatic antigen to helper T lymphocyte. And this leads to activation of the T helper 1 and T helper 2 and secrete of the cytokines. And there is a liver cell injury which is caused by the action of T cytotoxic that lead to stimulation due to secretion of interleukin 2 and complement activation. And also there is involvement of the NK cells in the destruction of the hepatocytes. And also there is a reaction of the antibodies against the liver hepatocyte, and this is called autoantibodies. That's called the hepatocytes from the patients with the autoimmune hepatitis and lead to destruction of the hepatocytes. And the autoantibodies that are produced, which they are non-specific, like antinuclear antibody, which is found in the serum of the patients, and anti-smooth muscle antibody and anti-liver kidney microsomal antibody. The classification of the autoimmune hepatitis depends on the autoantibodies markers. Autoimmune hepatitis recognized as a heterogeneous disorders can be classified into type 1, which is most common in North America, and occur at any age, and type 2, which is less common and often occurs in children and adults than adults. Diagnosis can be diagnosed by blood tests that help to distinguish autoimmune hepatitis from the viral hepatitis. Treatment by corticosteroids in high dose, immune suppression by use, generalized immune suppression, or only the immune system suppressor would like medication to suppress the immune system to prevent the body from making autoantibodies like Sandimmune, Imuran, and prednisolone in high dose. And the advanced stage of the autoimmune hepatitis